you gotta put a little bit of lotion on there. Get some. There's a lot of good trigger points in the forearm that will help. And we're gonna do some face up and face down techniques. Try to always push the blood flow up towards the heart. All right. Just gonna work each little finger. Sometimes it feels a little good if you do a gentle like pull, and get a little pop in there. Just don't pull her finger off. All right. And put it down pretty low. If you get your two palms, you can actually open up the palm a little bit and help the. You got your median nerve that runs under this little tendon right here, and that's when it happens is you get carpal tunnel when it gets really tight and compresses that nerve. So what I like to do is open it up like this with my palms, and at the same time I'm pressing up. It should feel pretty good. She's already asleep. All right. Always good to get in the thumb pad right here. It's I'm sure that's the anatomical name for it. Thumb pad. Good trigger point right through here. Just gonna hold it and release. Little tender in there. And you can actually work in the middle. See how my thumbs are kind of pressing it out like that. Because I like to open up the hand really good. All right. Now I'm going to do, when I turn her face down, I'm going to work the bottom of the arm, but a lot more. But when I'm face up, I tend to focus more on the top. So this table's a little too low for me, so I'm going to be on my knees. I was too lazy to raise it up. So it's good to use I like to use these two knuckles. Kind of hold their hand and lean in like that. Just lean into it. Slide back, lean into it. You can also try not to just, work it like that with the digits, because you can end up hurting your own thumb. You can always put your fingers here, put your palm on top of it, and just run up. See, without maybe even pressing any harder, it's a lot deeper. And at the top, you'll find a nice little trigger point. If you'll see this thing hopping around, I don't know if you can see. Kind of press right in there. You feel that? And then I like to also, you can do some passive release. Turn the wrist with it. Turn the wrist the other way. If I want to do some active release, I can hold it and have her turn it. So go ahead and turn your wrist. And the other way. Good. Sometimes it feels really good. You'll feel like the blood flow rushing in there. Alright. It's always good to make sure you get the bottom of the forearm too, where the flexors are, because we tend to use a lot of those muscles a lot and get compressed and cause a lot of issues. Next, I know I said I don't like to hold the arm up, but in this specific thing, you kind of have to. If they start holding it up, just whack them and they'll stop. I'm just it's totally professional. I'm just kidding. So what I like to do, you can actually grip like that, and then I like to turn them as I go down. Using their body for it, so that I'm not having to press my thumbs in too hard. Make sure Caitlin can see. Caitlin's our photographer, our videographer.
Yes, sir.
I'm imagining she's doing a great job. She probably forgot to push record.
Oh man, I did.
No.
I was kidding.
So always work the top part, and then like I said, I like to come and do the same thing, kind of like an Indian burn, but with lotion, so it doesn't hurt. And one more thing we'll do on the face up part. See, we got a lot of blood flow going on here. That's good. Is you can actually put your forearm along here. I don't like to do this because that would hurt like crazy, and then there's a little muscle that goes across. Try not to put your elbow right on that, but would go right above that. And if you need a better angle, you can shift a little bit and just kind of glide. I don't like to like drag through it just because that would hurt a lot more, so I just kind of slide, hold. Okay there?
Mm-hmm.
And if they have any of the hand and arm pain, really focusing on that trigger point. But after you work that trigger point really good, you always want to spread that blood flow around. Another thing you can even do, I like that you can kind of give them a handshake if you want to do it that way. Because I like to keep their arm down so that they don't try to hold it up. So kind of. Does that feel good?
Mm-hmm. Yes.
She knows better to say no in my video, so. And you can kind of flex their hand if you need. Do some. Actually, it works better like this. Leaning in. Therapists that, if y'all struggle with getting deep pressure, doing it like this actually helps a lot with them face down, because you can actually hold their hand and kind of work your way up like that. And her leg just jumped, which means it's usually a sign to go deeper. Kidding. Some slider. And one of the reasons I have my hand on her hand is that if I feel her kind of flex her hand a little bit, I usually know if it's too much pressure.